Hello everyone, today I'm going to be talking to you about hepatitis E virus.
That's me.
Some of you may have heard of hepatitis E, while I'm sure many of you have not. Most people are more familiar with hepatitis A, B, and C, although hepatitis D and E also exist. Hepatitis E virus, or HEV, is a virus placed in the sole genus Hepavirus in the family Hepaviridae. There are at least 4 different genotypes of HEV. Genotypes 1 and 2 have only been found in humans. Genotypes 3 and 4 circulate in several animals, including pigs and deer.
Please call me Happy.
HEV is a small, non-enveloped virus with ssRNA. It has a genome size of approximately 7.2 kilobases and a diameter between 32 and 34 nanometers.
Don't I look beautiful?
HEV has a fatality rate of 0.1 to 1% in infected individuals. However, the fatality rate may be as high as 25% for infected pregnant women. In 2015, the World Health Organization estimated that HEV caused 44,000 deaths, accounting for 3.3% of deaths due to viral hepatitis in that year. HEV is most prevalent in countries that have poor sanitation and contaminated water supplies, such as East and Southeast Asia. Outbreaks usually follow fecal contamination of drinking water supplies and may affect several hundred to several thousand people. The picture shown is a map showing areas of the world where HEV is more prevalent.
Going on vacation. I'd love to meet you.
HEV is the leading cause of acute viral hepatitis among adults between the ages of 15 and 40 in developing countries. To explain the higher prevalence of symptomatic cases in adults, it has been suggested that these adults may have contracted a silent infection of HEV early in life, after which immunity wears off after 10 to 20 years and they are again susceptible to infection. A majority of HEV infections are asymptomatic cases. The World Health Organization estimates that of 20 million yearly infections, only 3.3 million will develop into symptomatic cases. A vaccine to prevent HEV infection has been developed and is licensed in China, but is not yet available elsewhere.
Please don't tell your friends about the vaccine.
Hepatitis E infection is clinically indistinguishable from other hepatitis infections. After an incubation period of 2 to 9 weeks, infected individuals will experience symptoms common to other types of hepatitis infections, such as jaundice, anorexia, abdominal pain, and fever. The disease is usually mild, resolving itself in 2 weeks and leaving no long-term effects. In rare cases, a serious disease known as fulminant hepatitis or acute liver failure may occur and be fatal. Currently, there is no therapy that can alter the course of an acute infection of HEV.
How dramatic. It's not that bad.
HEV is transmitted via the fecal-oral route. No information on the infective dose of HEV is available. Other transmission routes of HEV also exist, such as ingestion of undercooked meat from infected animals, transfusion of infected blood products, and vertical transmission from a pregnant woman to her fetus. Animal reservoirs for HEV genotypes 3 and 4 include pigs, wild boar, and deer. HEV RNA has been detected in swine urine, suggesting this may play a role in transmission of HEV within this animal reservoir. The typical life cycle of HEV is as follows. First, contaminated food or water is consumed. Then the virus multiplies in liver cells, enters the bloodstream, and travels to the digestive tract.
What? Even I enjoy bacon.
Detection methods for HEV include ELISA, reverse transcriptase PCR, real-time PCR, cell culture, confocal microscopy, and electron microscopy. Although culturability of HEV has been demonstrated via cell culture, the lack of an efficient and reliable cell culture system and practical animal model have hindered studies on mechanisms of HEV replication, transmission, pathogenesis, and survival in the environment. In clinical samples, real-time PCR is the most popular method of detection for HEV. Although I could not find any information regarding detection of HEV in water samples, multiple studies have shown that hepatitis A and other enteroviruses have been detected in water by reverse transcriptase PCR, suggesting that HEV can also be detected in water via RT-PCR.
I am not a big fan of peekaboo.
Research shows that HEV can be efficiently removed by typical treatment practices. One study showed that 2 log inactivation of HEV occurred at 0.41 milligram minutes per liter in buffered demand-free water and at 11.21 milligram minutes per liter in water with 1% sewage. Both of these values are below a typical chlorine dose for drinking water at 30 milligram minutes per liter. 4 log inactivation of HEV has been demonstrated at UV dosages of 23 millijoules per square centimeter. This is lower than a typical UV dosage for drinking water treatment at 40 millijoules per square centimeter. No information is available on the removal of HEV by other treatment methods, such as wetlands or aerated lagoons.
Ouch. I thought we were friends.
Here are 5 key takeaways from my presentation. And most importantly, please remember,
If you don't want happy, don't drink pig pee.